So let's say you're in the office and you have a kid with headaches. We've talked a little bit about some of the red flags, talked a little about some of the findings. What do you do next? And from a very practical standpoint, the questions we get a lot are, who gets imaging and when should you have a referral to neurosurgery? The short answer is, if you ever have a question, please contact one of us. We at the end of the talk will mention ways to communicate with us by email, by phone, but sometimes a very short email or phone call can really save the family and the patients a lot of trouble, either with unnecessary tests or with long delays for worrisome findings. We can either expedite things that need to be moved along or hopefully reassure when there may not be that need of urgency. So I would really emphasize this ability to just reach out by email or phone to help to work together to figure out the best course of action for kids. That said, some of the red flags that I mentioned really merit an urgent call to a neurosurgeon or an emergency department. These ones which I just reviewed really should not pause for further delay, but if they're present, really should just think about getting the kid directly to a center that can handle neurosurgical emergencies. In a more general standpoint, again, every case should be individualized, but thinking about them, some of the things that might merit further evaluation or imaging, if there's a nocturnal headache that wakes the kid up, or if there's morning vomiting, that should merit imaging. If the headache's worsened by Valsalva or coughing, might think about evaluation. Distinct new onset of headache within 6 months without migraine features that's progressive, or any progressive symptoms are usually worrisome. If the headaches have a neurologic deficit, and if the headache is in association with worsening fevers or neurologic exam, these are all things that really should be considered for further evaluation and potentially imaging.